chia ya dofo mo ni ada o ma se efi se omo ni ho aye ni ho o ma da roma ni ti o mu tie yen any suggestions o mu dudra yen any ensem o mu bisa yen ti na ama programming so ya yesi ebe ko nanim ye di kan da obo ade aseso abo ye ho ban sonko na eye nne opekon da eye aduonu nkono ana se meka no January 29 or 2 days per year February mo abo ye ho bon abo ye ho ban abo 723 na adumara kan odi ababehia mu na do for se ne munim no maka say Friday me gi me chair ana me gi makonya na metena asia na ye wapomuden ho asem ani makwakofa doctors akukudame ani nurses a omo nimnimde omo experience ehun nsem na ye de bra ye ba ye de yare ehun nsem aba ba kire mu na mo wafutuo bi a na asem wa bisadie bi a na mabisa ye nipa yi de a ye didi ye nom ye dan ya ye be yare bi wo ho aye si eye busua yare me ma me nyaaye me nana nyaaye ti me soso no kosi na hia me nya yare bi soso wo ho a eye yenya libisa ne eti ebi a ye didie ye ne ye na edi ehun sunsuanso edi brain ene ye beka yare no ba ko ho asem yare bi a ye friend say diabetes ana asichire yare na nyame chade eye nurses ne ba ko ono aye living testimony a obeka ho asem a kire yen oye guest nsoso osanso wo foundation ayato ne din se Frankel a wo kire eye diabetes ene niam ebe paso atnase I live with diabetes very well for a long life diabetes in aye management and no better ho asem kes bebre ye wo doctor wa dori nro mu ye pa obekire wo nro na wa kire natural remedies ana anuane bia yenya edi a emfa susu aso mre yen aye ye betimi dia control o diabetes munya amre na mudi tie yen yamre ko enti ye best start anase ye de nsam ne be hyehyɛ so na ma introduce panel na kyerɛ mo na ye diabetes ho asem aba pomodin ye be share link no eye Facebook link pomodin wo so fama odofo bi wadanfo ana wonua bi ebeboa no wo kwa bebree so efisɛ sɛ ne medi kankan ye no ye nipa ye didi ye nom ye koba de no kware kosi na hia abeyare obeyare yare ni bi wo ho a eye bibikitwa bi ebetimi dia manage obeti ho nsem bebree ti bomodi aso be share yo ni edi kan no may introduce my one professor Rose Kranzia anase Dr. Rose Kranzia otra BSN nursing students ewo Feedback State University or ye empanifo no professors no ye company for ye rank ye na say hierarchy or company for ne ho nyame ayade yenya bi before yenya nipa yenya nuanam omutumi ko manim sa eye class ma yen etre mema woni na kasa no wa promote ana so wa connect o e kwa obefa so mo atimi am boost o ho ewo knowledge mo ni atoso bi o so eye Dr. Janet Quantin SRA or your pharmacist ewo U.S.A Memorial Hospital U.S.A Memorial Hospital ewo Worcester ena ni otoso bio SKF on no platform na nadaroma ye de health ehun nsem na say yare ne the kwan be fa so ama ehun ato ye ehun nsem e de prayen na yakọ yen ya Prince Paul no na oba so no wa DJ amayen o kapano ne ho na me cha de enne ye nyawura ba kama o nimdie bebre wo diabetes ho na se na me kan ye no will be into him or better a form of manage. And not to a Bria Foundation or church and near my a bepasso and live with diabetes, ye better any choir or faso diabois and your community and in the nation as a wide entire nation. Nidi Lydia Agent. Patrol Mamuna Aquaba.
Yeah, Joseph.
Joseph. Yo, lady kind and sana ye beka diabetes mo asem no. medical center Dr. Rose esan say we educator and so no meka say ka obetimi a kire yen kwan a diabetes efa so ba niema bi esi ehwe ne niema obi betimi ehun say or diabetes bi wo kra na onim na odene nambo timpacho betimi abone topper mesra wa so be ko ni layman's term pacho break no mane ko form kra yesremo na se ni obi a so beti ase pacho mo anonko.
Okay. I'll be with the panel nasi say my friend view and now to send you make last week maybe me follow lawyer. Maybe more than about layman terms, but brofoni be so what I mean to me can the tree.
About you.
Okay. It's you very sure say diabetes, you can't say diabetes, diabetes yeah, they a group into different say yeah, they are different types. Into a BBS wunya, you can say blood sugar, blood level, glucose level. Into yes, you can say glucose acosoro. And go for you, can say when you see yari, right? Into blood sugar. Into sugar near baby or system no more any friend say when you blood sugar. Now bibia a bit to me say about it may cause a serious so bit me ya different from that. So when you a sugar na a bit to me ama alcohol. Into you can get life-threatening health problems as well. Into no, there are two types of chronic diabetes. Into measure with when you diabetes, diabetes type 1 diabetes 1. And about say type 2 diabetes. Into ni na ebeko in more details. And about so what it be obabi fire funua. Utumi enya diabetes. A friend no transient. A bibia ebeba ebesanko. Into no enya permanent. It's a friend transient form of disease. Your friend gestational diabetes into a obano nyim na so wuya sa diabetes na na echo. And a war condition miss answer yare bebro answer beka so when you hypertension so when you diabetes. Now say when your level be or your friend BB, you know it's more geared towards that type 2 diabetes. The will be a friend no pre-diabetic. It's pre-diabetic anything. Pre-diabetic, usually we call Dr. Mbaye or test your test no A1C. Into normal A1C level no, there was a 5.7%. That was mojano. Into say your choir will test now, so we are between 5.7 and 6.4%. Your friend also when you're there pre-diabetes. Into sad time no when you're diagnosed with diabetes, but in your course a bro 6.5 now. Not when you're diabetes. Until you was last stage no. Before in your pre-diabetes, but with a exercise near the Dr. Janet Becker who has no. Who bet me a free pre-diabetes won't call a home. Until no, my anchor yedi adriane. Most of your adriane your friend carbohydrate. It be a friend ye doc no ye fufu ye most of the a friend carbohydrate. Into woody carbohydrate now would we read no. I was say Adriana no a break it down, right? Into say a break it down na body na carry a bit called mojanum. It's a mojanum. I was say a bit break it down into glucose and then it goes into the bloodstream. Not bloodstream no. There is a hormone mean to be insulin. Your friend a but your honam moja no any produce your friend insulin. Into insulin no na eboa. Ema ye produce a ye bubu sa neoma no glucose no na moja na afa. Aduane na ye di na e dey come the whole part of the body.
Why uchi no way identify to carry on.
Mate. It's insulin hormone na produces beta cells. Beta cells na ye part be a friend pancreas. My name ni tree. Multi pancreas dona and beta cells they bring out the glucose. Now I break it down. the carbohydrate that we eat. Into no say pancreas no into me produce insulin. Ebia it produce insulin ketwa bi and I say bia into me produce that cells ni into me target glucose no. Into yes na ama moja no blood sugar na moja no na ye bebre na si ho. Into yemfa ne say woko fi wo wura dem outside ho ne ye moja no ho. Wo de wo safo wo de wura pronom wa bie na wo wura na ebubu no watumi awuro but wo drew outside on say wontumi wuro ma wo de safo ne wuro ntumi bia na just na wa ka bontin na abontin ho ina e blood sugar nti moja no ni ina na moja na nti no meko type 1 diabetes nti that's just the beginning of senia wudidia blood no be break aduane ne down nti one you can so be anya type 1 diabetes ne ba e just pancreas no mu cells now the immune system nankasa it fights against itself. Ye nima de frontier emani basa, but for whatever reason we still don't know. They're still looking for it. It's part of genetics. Genetics plays part. It's na wo be na wo can say ya rebi or why we busianu menya de obetumi adwane afri no. Genetic plays some of the part. And then the other thing is so pancreas may destroy the immune system is by mistake. No, destroy the pancreas. No, and mast cells now more produce to break down the glucose. No, they don't have it. And there's no insulin production. They very, very reduced in that stage. And type 1 diabetes, no, abrofo friend no juvenile diabetes. It's just eba or call a brim eba ansa when you're 20 years. Into no a type 1 into when you type 1 diabetes, I just say senior immune system no is fighting against each other and they can produce the insulin. No, you will be dependent. I will say you do to insulin, so you wow insulin panier. Into type 1 diabetes into one no. We won't say insulin dependent. Into difference a type 1 diabetes and into ube you need insulin and also Dr. Janet different types of insulin once I won't even bother there. Into type 1 into type 1 the diagnosed before 20 years. It's in genetics it be a and that's cells nankasa or your immune system is fighting against each other. The body is not producing the insulin. Okay, until you need insulin. Right. Then we move on to type 2 diabetes. Type 2 diabetes, pancreas no produce insulin, but it's not enough. Something goes wrong. They said me can't no key na wo de ba na wo de rap no wetumi abie no. For some reason because of a lifestyle. What am I saying? Lifestyle. Nioma bia ekokoso ho no ye exercise ye duane die ne ho keka ho nti na ama safuano research kin na de safuano shem no ehun no adidi are na se bibi sa nti wo de safuano shem mu a enye yi the receptors into me and receive it. If the receptors are not able to receive to me glucose na yen to me nya ho bibia into no my body no resistant to the insulin like was say bubu glucose no into no usually no type 2 diabetes no no insulin resistant diabetes because on glucose no wo but into me and rare receptors no na etumi akoye adwuma no into no ebasa na nipa no e was say most of the time no so to me exercise na diet ne ka ho na etumi but most of the diabetes type 2 diabetes we talk about lifestyle obesity kesiye if you say we kesiye na yes why kama ade nko a enti kesiye any unhealthy aduane di mo no enti na no nyina ka ho na e ma yenya diabetes na type 2 no started from age 30 Unse me say back on ye 20 juvenile. Inti Brabono, aircon, no nobody need shame. Inti drew 30 when I said there be a trophy name conk county, this or she name county and exercise now. Let's say, okay, maybe not type 2, not Baba. But when we share statistics are 80 to 90% of diabetes type 2, or more diabetes, no, type 2. Into which means say Brabono promote diabetes nipa no into no say sad yare wo mu a how if enya dey betumi aba onset so quickly into some of the symptoms are obenya no say yemfa say moja no sugar na age na wo moja no musa na efa wo urine into bia obi wo ha odwon so a na sugar ne wom bebre. This is how they can do the test and find out as well. If you are a blood test and maybe we can find it from that. Now, Sabanisa na a bit me akoso nyoma bebre. If you are ultimate, ubet me adjun sosa no phone, right? If you can lose weight. And now on obinya diabetes, obenum siosa, onum sio, my friend is thirsty. Obenum siosa. You can drink gallons of water, you're still thirsty. So those are some of the some symptoms, because the symptoms then yeah they be sorry one day but those are some of that. Say anye year so blood sugar no blood no musana say anhwe ne anye ho adra. It's me cause the ubetimi anya heart attack, ubetimi anya kidney failure. Ubetimi enya prolonged no, you can get nerve damage. Nerve damage no near money serious no say and nine say the nerve endings no enye juma. Ubetimi enya crow. Ebi a crow be beba abeda onan ho. We na dra enko because you have had damage to the nerves down there. The blood is not flowing there, and most people can inspire ubenya a chronic core at the South when I was a kutcha nipananai and I see visa. And it's all part of diabetes. But say it's all managed. To say a type 1 insulin, no. Type 2, you I heard a friend saying treatment, your mouth drew. You were drove for the mouth. Into say doctor mouth dry was say offer those into the difference between type 1 and type 2 in all conclusion, and they say type 1 a bant and juvenile a collaborate mania and on a wabusiano, and I say the immune system causes it over for insulin. Type 2 is diagnosed after 30 years. Yeah, lifestyle neho count so count and a money a basa. Into most of the times you share it's going to help. I believe say time and I say
yes.
I believe made the media here and then
yes.
come back we'll circle back.
Yeah, better about so.
Okay.
Now thank you so much, Church. Minimum say when you I can teach cano adding.
Why are
and now which you say type 2 no percentage statistics share percentage 80 to 90%. Into say that amount no you do any your nanti and I say your home day account pa. Actually no member I want some na ya can want some. Now maybe your time kono member Dr. Janet so atwaso ewo enuro ene niema e betimi dia yapo ane wia na fe yakọ yenya host.
Yo, that's it. That's panel for. And some mechanics, Dr. Rose, I can't be brain. Now, I dare back one, mechan afford your kind because they can't run who say my baby money say. So they all kind say moja a situation or moja anymore. Pancreas, no, I war your funimuna war a produce hormones called insulin. No, a pia. Sa a situation no efi moja ni cost anymore. A stop a do a 100 piano cost on muscle no yen a juma any idea for energy, any idea, a bit store will live anymore. For future, so then I say, oh, when I say, common the what now we need liver no, ebe release, some glucose, nibi kakra, store in the form of glycogen, but they very release yaba, more as glucose, use it for energy. The mecha fashion because mecha as I go along with the neuroni bio hard, dear, no, Tina Mediva, and I also a neuro. And another Dr. Ross can say they can diagnose. If you are diagnosed, they go with your A1C. A1C, no doctor, no etimi. Some of the diagnoses, no, you use A1C. So A1C, no, or use a long term a year, or tell me say what diabetes because if you are a store for like 2 or 3 months, with your so A1C, no, so A1C near higher. Dr. Ross kind on 2 consecutive time, then you are diagnosed with diabetes. It's neuro treatment. If you are maybe starting with non-pharmacological treatment, which means any drug treatment. The first thing on the culture is healthy eating. You have to maintain a healthy eating for treatment. Even crampono and yet for treatment, before cellular diabetes, no, just to prevent it, no. Healthy eating, fruits, vegetables, lean protein, whole grain, and a high fiber diet. The diabetes those are the kind of like a year or so low fat and calorie diet. And you cut down saturated fat. And I refine carbs, said Dr. Rose kind of refine carbs. Drinks, you have to avoid it. Physical activities, Dr. Rose kind I'll just stress a little bit on it. Aerobic exercise, so I exercise no etimi movie, sugar no, every bojanim eco cells nimu. So yeah, very good. At least three times a week, swimming, walking, brisk walking, all that. And as our diabetes is you monitor your blood sugar as many as possible, especially if you are on insulin. You're sure your sister Lydia can want them. Another non-pharmacological treatment if you also, especially for type 1, no, say a drew baby a GING transplant. It's me transplant pancreas transplant. And if you also not type 2, there's no way out to it's me bariatric surgery. So the also better now I reduce insulin and so. And I buy a draw a drone idea because in there was so many kinds of enroll for diabetes, different types. So I will not go into it. I'll just tell you you say because me can't cry diabetes. I'm saying me internet ni embassy of kakra. Enroll ni bi Emma pancreas no release the insulin. So that's Dr. Rose Kaya no say pancreas no release the insulin timi eboa for sugar regulation. And no be eboa Emma release the insulin from the pancreas. And I know be also inhibited like a breath the release of glucose. On say because liver glucose ni be a store or liver ni mu. Enti enro ni be preventing liver from releasing glucose. That's another class of enro, different classes of enro so the beya emma sugar ni no so cell anymore. And I enro ni bi so preventing intestine from breaking down the carbohydrate. So the beya say Dr. Rose can break down carbohydrates now I done it a citrate now call boja ni and running behind prevent a blockos. And another type of a horse preventing kidney is a very reabsorb also because liver no because it not be called liver anymore. It not be have prevent it from sugar and call liver anymore for storage. It not be have block that process no so the end call liver anymore. And then not be also a block process from releasing insulin from the liver no those that two processes different tasks. Usually no, so obi o na ya diagnosed no, especially type 2 diabetes na. Obudi kind ma metformin for type 2 diabetes. Obudi kind ma because they're very, very easy to tolerate. And boys, it doesn't give you hypoglycemic right away. Just a mouse sugar and cut down straightforward precope. Very, very good to most of the time, first time type 2 diabetic, the metformin they decline at the mouth. Enroll classes, different, but enroll more information about enroll particular, especially the who was now. I can tell you, but it was different. It was from the urea. It was way different class. So we're not going there too much. But I was stressed on insulin because our insulin it me cause a lot of problems because people don't, funny year, different types of insulin. How they store it and all that. It's a money problem because me say me I'm a diabetic. Or year from insulin at one store in a year. I'm na hoarding so tea yet to a co-warrior no a timid a coon no one effect from it. It is a mechanical doctor classes of a neuronamicano or bet me more than one class depending on your condition. Also or over to insulin so because pancreas needs me and your insulin and I say there's Dr. Ross can different types of the way our pancreas needs to meet and release insulin and you're sensitive and all that sort of kind and only be a bit me the insulin so I count it depending on your condition and they said doctor who said where you not could do it insulin you will be a friend of rapid acting insulin there a very dignity rapid within 15 minutes now I started a show effect until I best stay with more for about 2 to 4 hours. A say a friend Humalog generic near Lespro insulin Lespro then rapid acting it say you'll be a now we offer insulin till we are ready so that's the time you take that rapid because it's very rapid within 15 minutes. And it will be also a friend regular short acting if you also short acting in and 30 minutes and it started. Now I hear Juma, all along for about like a picky about 3 hours and then you see the effect. And they go intermediate. I know that type of insulin, I've got regular insulin. Regular is in the short acting and the regular insulin. And they were intermediate. And no, they are more be a best sustain kakra and 10 and no starting say Juma from between 2 to 4 hours. Now for a picky, a best still more about 4 to 12 hours. And no you're intermediate to and only NPH, and your friend NPH insulin. They all depend on how blood sugar and aircon this kind of insulin. And they do also a long acting there. If you person cover sugar now overnight, and I see longer acting, best stay for about 24 hours. We are 12 to 24 hours, and a bini lantus, which is glycogen. You also a levemir, which the generic is detamir. And they do also swear. So they will diabetes no doctor need to mix it. And you will be that I am mixing that out. It do a rapid acting and intermediate joined together, long acting, rapid acting, just a 70-30, different types of formulation based on the type of condition I or they do also a pen, easy to nothing I'll cut train. No, I didn't know the doctor no a bit I catch you said okay, you can insulin different types. How to store it, which is my very, very big concern, which I always stress on it. How to store, baby, how store insulin in a year. You have to store unopened bottle and a vial in a refrigerator. So me I no fresh now baby now you keep the unopened one in the refrigerator. And farm me fridge in the straw pan. Maybe a whole new pan. You don't want that because some person be freezy. And I won't find shed door no home because door no be. Baby, I would say a middle part. It has to be about 2 to 8 centimeters. Celsius. And you have to actually have that in the now on the door and now up on the fridge. Maybe a whole new pie a bit freezy. Just be careful with that. And I was so of us baby not could be about quanoa. You just have to make sure say ube date is our bottom that will be unknown because 28 to 30 days the max there will be also touching it. After 30 days now, 28 days no, you don't use it anymore. And yet I expire 28 days will be from the day I will be I will say or touching it. And making sure say store baby a area and sunlight a bit degrading and yeah juma. And our baby and a baby. And I said, we even known as outside room temperature, making sure that any bathroom and in the kitchen, it has to be a very cool, dry area, away from your kitchen because a higher shit, a whole shit. So you do a while, will be a home, we couldn't fear me pass and could be a cabinet. Hey, cabinet one I would do no. A whole kitchen cabinet is a no. Bathroom cabinet is a no. You have to get a very nice, cool, dry place now. Wash store with insulin. And safety. So we can now call you insulin free fridge. Now who say regular insulin are very clear, colorless. And you say okay you insulin no now baby you should know who said. And yeah bibi kakra say a cloud kakra I say and yet may you sue. And NPH, so that intermediate insulin, and no, I was here cloudy. So we call fast science in a cloud now who said, I didn't feel being in a moor now flat be a ye be the moor, and yet touching it, or the wa and bow. And I will have a date in our value, so I aspire even one day touching it, and yet. So call fridge now who said, I said the icy kakra woman and yeah, touching it. So we use pen needle no. That's a who said why you suba akuna or the to baby. You don't use it anymore. You don't use it again. You throw it away. It's not safety no. Obi me to us na still on met.
But you must have what was about obi the question by and not your guest and so see and then can say into patrol come on see not the amount was so within short time.
Okay.
Long-term effect for diabetes in our kidney so because now said Dr. Russo Casanoka the long-term effect. It will be trouble say long-term effect of kidney or diabetes.
Long-term effect kidney failure. And see, kidney failure, what does kidney do? Kidney and on a filter your Johnson, right? And a juma bebreba those the tubes, the glomerulus, all those tubes are working hard to get rid of those sugar, right? The overworking of all those things can lead to kidney failure. Into kidney failure and then blindness, any stroke. What do you about them? I'm fan count.
But you, that's it. Into Dr. Akasa.
Not me say heart attack. No kind of when I said this Dr. Rose kind you will not feel it. It is a baby wall cry. Who said baby wow. It is no son bet me to crow. I'm a 1 year and I do end up in amputation.
Yo, yeah, that's it. Pacho, yeah, twasso. And some a bet twasso. Now, your questions and answers. Now, your course, your promotion. any remedies no you be my host Madam Lydia enso so akasa na waka ni patients so ho asem obeka ono ano yentim free nanum eti pacho Auntie Lydia ye bi na yenso
Me cheche amunya.
ye so
SKF me da say munya mama ma akonya aba TV Facebook onyame onhra no nya okese abre nyina no de bia me ne di nkomo me ka say diabetes yare bia obi amfa ne serious and so omo fa ne serious kra omo de tete because of all say a big four be ne de atoyare na ma no and I say bunsam bi and I say mame wate bi and like a whole lot of misconception and right. You know me sharing my story, you know, all the time, you know, it inspire a lot of people to come out say, oh, sa me what diabetes and they say it's you know, I'm me happy say me nya akonya na me de share my story na inspire and for and you know me da mu nyina ma say me by America 1998 na me buy in 2 months me by America and me yare na to New York me yare na I remember say that signs and symptoms na me nya that moment I'm in New York no me kai say mo secondary school na me nya me yes okins which me no me de pa na me de si chire gum and was say me dis okins ni ya after that me want me say form so enti me all along na me feel say e come enti no me yare me nya the same symptom but this time no me nya cramps e wo me nine na me timi kwa nante me jo so sa oh after na me ni se me hwa ade kra na me bre na ye fa ne say o ma me be share o mo no ba ko de me call ye fa ne say emergency room e wo New York Montefiore Hospital enti me call ye no omo hwe me ntenti me kwa de come dey before e dey story akosi and I'm still okay dem amenta ho to cut the long story short enti omo kwa ye me test blood you bebre enti results ne ba ye no na say minim the reason why omo ma ye me A1C test because na me kan chom say bia me family history but em say me signs and symptoms no and ma omo ye out of curiosity anyway so omo ye no me doctor say oh okay obusa me say me mama me busua ni bia but am so yeah the kai say me mama and na owo bi but me o catch me I don't know anything about it until doctor ni church me mu an say o A1C ye dey hwe so we diabetes no wo dey 13.5 me dey na me to ho because me minima de kro minima de kro na me dey need tie bi until no me nkope PCP na me follow up with care obia ma ba America 2 months ni mu ma me be ye djuma aye me ya o se me kope ayi baby ti menfi man so ma nya ho hwe I didn't go look for nothing then I went about my daily life whatever so I was in denial for so many years as I should put it enti me nye me ba boy and me nya gestational diabetes they say obia me na me what insulin I'm not kidding na me what 100 units a day like an opa area you na me canning in albuma and you know it was serious and me who we so enko na doctors ne say me follow up me enko na sa and me do me ba last one ni wie ye no and doctor endocrinologist na o hwe me mani nyina no ono answer na hwe me enti me wo me baketa ni wie ye no na say me sugar na say na was through hospital ho na was through I was in I think in the 300s na enti me nko form and on my doctor ni buy or doctor ni buy no Lydia what this time whether you like it or not you know you're going to because that time I know who said yeah me type 1 and said type 2 enti your hand was starting with insulin or the prescription in my one vial of Novolog na me started and I'm say okay or they told her abia or be me do fear them to forget it me na me fa panian wo me ho and I just went about my life like and people who know me you know I like wearing high heels. I like to party. I used to drink like, and I didn't care. All this time, to people said once in a while be not like I kicking me say, oh, yes, what diabetes, where do you? Oh, now my forgetting. And see, it gets to that point in my life. I'm like, you know what? I need to do something. And see, I started your friend say me pet doctor now my static care. And my static care and almost started me with metformin. They said the doctor again can almost started me metformin and yeah juma almost the to glyburide so and yeah juma. Into how I'm paying me test and making sure say it determines me type 1 and I said type 2. And say almost paying me no I was type 1. And so all along, the materials, my pancreas, it doesn't produce insulin at all. And me the only thing is stable me, me obi am impaired and all the chocolates, but one I did for so I'm a chocolate, and major for food. And see, and me pension, and to that and yamano, and I'm the am case is save room. Aha. And see, just after I'm me to insulin, so now me what a year finish short acting 3 times a day. Now my all answers and I just but I wasn't compliant. I wasn't seriously. I wasn't. Maybe a 1 month. Let me that to me what na me nenam hɔ nti no mebɛdi dia me aduane bɛn mehunu dɔkoro na manom mɛdi soakings mɛdi memfa ho nti na meyɛ home care na meyɛ SKF na ɛyɛ adwuma nti meyɛ home care no for some reason no me patients ɔmo maa me nyinaa ɔbea ɔmo nyinaa diabetics with wounds with this with that meaning why ɔmo I don't know. Maybe God was trying to tell me something anyway. And see me kwa, hey, we mammy back, we any crow way, hey, I yes, a qua, na afroko ha, I yes, a qua, na afroko and I ha, na, hey, it's I say a be harming, and I'm saying, you know what, taking care of this patient, I'm educating them all the time. I'm not taking care of myself. So I need to do something because otherwise, it's going to be a problem for me. And see, I started taking it serious. And I'm a doctor. One time I was driving, now me feeling kind of weird. I'm checking my sugar. That time I'm checking it manually, and my blood sugar was in the 500s, like 500. The glucometer kept saying high, high, high. That means I was like there. And see, and me warm my penny and warm my penny and take a time. So you know what? Me friend, my doctor, and me book an appointment. And see me book an appointment, and almost say, to see, and the only option they want to give me is insulin pump. I need to be on a pump because me get compliant, and I'm too young, that time, I have to be on the pump. Oh, me jaho Ghana, me koyare wo Ghana nyame nko into me back, and I'm a home doctor. I'm okay. I want to be on the pump, me start to use the insulin pump. Then now after me complaining, say me poking my fingers too much. That time not Dexcom back and I already me told Dexcom. See, I have insulin pump and a Dexcom, so I don't poke my fingers. Anyway, and see the reason why I me started this foundation thing, me back boy, me name me your first son, or not so it will be, no not so me who signs and symptoms, but as a mother. I'm like, no, this is not happening. I don't even want to think, say, that's what's going on in his body. And also, it will be paid, yeah, fine. And see, a course for 1 month. And now, my bad girl, the back pain, I catch him and say, Mommy, the way a junior, don't saw of school, but not complaining in 9 and all that, I bet say a diabetes. I'm saying, hey, man, cause I no, and you hey, or I appointments coming up. Me name a doctor Becca, and they scare me. I'm not ready for that. But meanwhile, it's not kind of seems fair. That the sana I cost. And see, anyway, we didn't call you. You died. You didn't call doctor's office. Me kind of whatever was going on. You check K, and yeah, glucose. Dr. Janet, sir, a keto sticks. Yeah, And I don't so normally be too. Oh my God.
Ketones.
Yeah, to check ketones. Oh my God. None of don't so quiet sugar. You're checking the sugar, you're poking the finger right there. The sugar was 450 milligram per deciliter.
Wow.
My yeah, na my cup akonya so. Na doctor say na ye ambulance, na de na call UMass. Na am see daddy. Me am driver de na call. Na doctor say no. I'm a driver. Na am see na driver. It's ye didn't call ye, omo ye the test just to make sure say onya ketoacidosis and all those crazy things. And see, you're diagnosed soon, no. Then it dawned on me, like I went into a very depressive, like I had a very bad. I was in depression. Like, you have no idea.
Right.
Me, how to put it? Say, Oba, oh, you're diabetic. Also, be taking Oba is type 1. We'll be taking care of Oba, and he was just 14 years old. 14. And I was depressed, I was anxious, just like all the mental
Right.
health issues. It was crazy. So one day, I was just there and decided, say, your bomb parents, you know what, I have to do something, say, to educate people and all that. And that was the formation of Frankel Foundation for Diabetics. And on the first name is Frank. And see, Frank, the first name. And EL, no see, my mother. My mother is Elizabeth. I know you're type 2. I know you're type 2.
Yeah.
And Frank and Elizabeth. Ye first two initials of my mom's first name. And I'm a Kabong, a Frankel. Until 2018. And I'm forming that NGO. No. Yeah.
Thank you very much, Lydia. No, what summarizing here, Dr. Rose kindly, Dr. Janet Ekan. Yeah. Now, and Yama highlight here, maybe sad, remember Dr. Rose and Dr. Janet Ekan was me. One who can deny and was them. So, who exhibit symptoms, no, but who when you go so, and it's true. That for Obia, your catcher and say, oh, you Okuma, it was right. Now, denial state because mentality, as you said, you're doing say before Mami Wata, Obi now to a drama.
Yep.
Now you're trying now progress it, maybe a leading any as that your problems and your kind, Sana won't feel it. Now, Ubet Mania, second your kind cardiac, and your mother so be to be honest with you. What can you now? What can you now? What's I highlighting medication compliance, and it's very, very true. And John, especially Mema, Emma, thank you. I believe say mummy and son focus and 9 SKF count education and that promotion of Frankel. Why I'm saying that, and I say, Nyoka, no meaning say, a Beman Crawford, almost so you won't pray that. Yeah, Sanya Frankel, yeah, the one, no. Inevitable, no matter what, there's nothing you can do about it. No better say, Ube phone row, where did the year, nay, why exercise? This is the health promotion that we really need to promote. Thank you very much for sharing. Really, really.
You're welcome.
It's Dr. Rose and Dr. Janet Patoni Edika Komano. Denier, a deity near Nenipa, Yaria, young Percy Becca. Mentality bang anywhere to Auntie Lydia wants to so count. Mentality bang war a trade, near DNA with Nyaka for Ombetsiki early help, now lead to these complications in future.
Oh, sorry.
Okay, so denial a part of your life. Okay, denial bibiano ye pesa obia ho ne ekoso yie we abrabo na ye pesa obibe ho ne enko yie e we abrabo but no most of the time so said and Sister Lydia can be brave yare no we associate yare to be any yare is part yeti asia yesi moja diffusania
Good job.
yare no part part because maybe na body no type 1 diabetes. Then never immune system fight against each other. Boom, all those things came through, right? And there's so many things going on in into honam na betumi ako atia into say yare ye to kwan ya ba ye wo doctor yearly appointment no akwa ye physical doctor ne kan prana se wantia we deny it because we don't believe it because any say yare but yare so a part of our body yare I was say ye kwaye ho adru into I was see a jitum ye hu say nipa ye na ma ye call be ya ye exercise neoma I was say ye na ye no yare de beba wonum sio bebre wuti be pa right into neoma bebre wo ho a ye ankasa no I was say ati ase say yare wo into no when wunya signs and symptoms no wunya ebi a what that sorry when it's brew I didn't know when it's brew there is something going on with you. It's not normal. Into now was say yade there is part of us. And until Yakopon amani padrin, amani kofosua doctors or moshe. Into okwa near shade cray near mount who drew. No affair drew. Oh, into Ninano it's like a vicious cycle, a coba. I totally just in my me type 2 diabetes. Type 2 diabetes no. And and also predisposing factors because ni mama were genetics or their own no. And I also need by she developed type 1 diabetes. The bano came through her. He developed what type 1 diabetes. Into the senior or when in any abria original nebanos, hopefully they will be able to break that cycle somehow with all this that she's doing. Into our say yeah, it's part of our life. And we shouldn't be shy of it.
That's right.
And no, we shouldn't be shy. I was saying, yeah, can't answer.
Doc, we are right. Mix na Habibi.
Yes,
I remember so when I started this Frankel thing. Now I call Lanchi Organa. I did a lot of TV, radio interview. I was all over the place, and people were saying "Semi interested anymore." Why? Because me come me yare me catch. I'm telling the whole world say I have diabetes. Yes, that's why I formed Frankel. I want people. Me person phone says higher railway shouldn't be taken for granted. And I always say, and Dr. Janet, we've talked about it before. And anytime I talk about diabetes, I get so passionate about it because I know what it has done to me. Prince Paul is my witness, SK is my witness, and Obia, I know, say, like me, I want to pay high heels, share me. But now, I have bad peripheral neuropathy. I can't even wear 2 inches. Even some sha, it's a problem. So I don't want people to go through what I went through. If say I wasn't in denial, now coming yake right there. And earlier, and coming, I will be able to still wear my high heels. I wouldn't even be wearing glasses. So me, I have like it's crazy. And all the time now, I'm so passionate about this disease. I remember me a program, Kumasi, one of my biggest programs. And there was this guy, Oba Honum. Oba, the gate was very, very unsteady. Until also a man called Sonimu. And now, what I share, minim that, dear me, who need that. And see, a whole of a tom sending any subrino. Anyway, you check here or go through BP. You're checking the sugar. The sugar. What you buy America day more? It was like almost 500. Yeah, busana say adaya we did you see there be or trying to pack on it. Now 4 years ago, and now your diagnosis your catch and store we see yare. And then the bush now first day a ya before ya rentino or more do sinibi and were a crate a shanty region a crabiase and fanning coho. No sinine very ebe sane ya rare and to say and that program also I did a massive media a talk papa Kumasi, all the big FM stations are a quite a call Boise, Peppa, the quiet, a honomo, no corning in our so. Ain't you know, or free Teppa, Headman crown so Teppa, it's and no free honor buy. Or so what's a funny say, one of the FM stations, so, and or buy into a buy and teacher in Vienna, or no question about you, it's meaning how he got himself on the trot to get to Jubilee Park, Kumasi. And see, doctor on board in the share, no, and of referring say, at the like that, yeah, Saturday, Monday, or Mama Dia, no pebbles when even kind of no branco for noche.
Right.
And I'll see you, Mate. Ye train on why you didn't cook pay baby time you pay drink be man on any other day. I see my doctor and kind of say, you know what? That if this guy make it or china, let me who say because this guy will not even make it on that Monday. It's denial no a biano no. Nebusia for say a bay for yare. It's something not hot a funny say create yassi do see be hot. To say brave, me say Mika say come yes your thoughts, yes. It's denial na biano no. And he said, I have been for area, and nobody talks about it. Nobody talks about diabetes. And a hammy. Because if people talk about it, people share. I mean, so Bianco over diabetes, I could not Mount Everest, but at least you can share your story to one or two people. Like say denial. Don't be in denial. Take very good care of yourself. Because with diabetes, if you take very good care of yourself, trust me, you'll be living longer life, fasting, only any health issue.
Exactly. And I know more now what kind of more than a be out because as you said, mentality, African mentality, say the beer baby, the beer obina tama. Meanwhile, wo generic and answer would diet. And yes, I said away. And then obi promote it make a chance say
exactly.
As we said, education because
education.
Now your education, now you be arguing almost say a chance work school there be. Now I'm a one yanti as yes say ya no e wo ho ade a betimi aye wo ho no ade bu wo ho a wo ye dan a e pepa. Enti you betimi ayaboa sani o kan no ubetna ase ache crossing obi kwa onu kwa oni any underlying illness. Enti thank you very much. Dr. Janet, me patcho betimi aka bi aka ne de ne ho. Aka waka o kan bebre about medication compliance. Boy na guy no ba eye na yi ne promotion no wo Kumasi no. Okasi a diagnosing 4 years ago. But somebody a share be enti omagya ebetima ba se doctor no so kwa no ka kire no one onis for the better adro two adro kra chairman mention enti compliance with medication woni mu nrom no ye na betimi aka fa woni akutu be na betimi di aboa
obi enunti na nyame amaye kwankyere say yenje sa program yi. This program aye no is to create awareness among crofo enhu say yare ahora wo ho and there's help emwa wo ho so allow yourself obi ube se nyankopon ena ma nipa nimdie ka kra wo ho kra etimi ese nyankopon ama nipa nimdie se wo yare bibi ye wakọ no mbe hu ba bi potin ade ne wo na estati a o masia no ansa na aye kese na de wo ho na okase me yare na me de hya me hu na me ferry no already anya ferry ko doctor. I mean, yankasi ko po hu dero say the sister e kan. But know yourself. I said Dr. Ross can you should know yourself. Nipa da se no ti hwa unim ho say bibi nkoye. Bibi nkoye a utimi usori a hu say ma nyema nkoye ma me nko hu mi doctor. Empen bebre no obi wo ho na ne diagnose hu obibi a na e de adroma na yetimi hu sa atama na me ye adwuma or retail no yetimi hu bebre sa bu o doctor na prescribe ade no amano no e be hye ho a ne asan yi akoto hye ba o magi na adro with the impression say adro amikonum yi sabio e mema na binum so e be kum mi bema na wo hu a o bema de o de ye den manu beko obi was you know and Robebre wa ya was side effects wo and Robebre was side effects but side effect nature no you will be correct no you better off say obefa bibi I control what is going on in your life than say obenya permanent yibi wegu ho na bibi be ya wa untimi the reason why one person be no aduro no kwa untimi fanye what you say you make sure say aduro bia or diabetes no is safe it is a aduro bia telling no crowd of a problem ubenya side effect every medication no has side effects but you just have to take it the right way so that you catch yourself no afani sa best sustaining life mo wadi 20-30 years crack ho than say one fahre na me ferry me doctor be who say me yare and I will be assume be who sometimes who yare bi wo ho no bi wo nche no nim say wo sa yare ya bibi ya wo no ba kun kasi bibi ba bibi ya mi sister na o yare we obe blow alarm no than say me no tifie me person be who say me yare sa yare na say that diabetes gra me manya severe hypo te say me sugar ne cough mo me ye wu a me nya stroke me nya seizures a oh hu de ye o right o ka say do say who sure say before na ye na do bi na achu I say be do wo no chem say nia you are diabetes so it is a who say bibi say cause na nko ya fred na wa mama na say fred doctor bi mama na say ebeboa enti na ye we no education so enrollment now is safe there's always something to help you I bet you sustainable life and now person live your life better you already obi say that kind you don't know where it will come from but as a person take care of yourself eat healthy exercise get work checkups can't afford, to be honest, I'm not saying anything bad about, but most of our Ghanaians, they don't go for checkups. Annual visit. Or see, maybe I call doctor where you go, you mean you're yes. You go, now you're ready, PF, no more brain, I say. Now say, oh, I see me call me, you're ready, you're ready, no go. What you say? Also, me yari, me bomb pie and yanko be sami yare. God gave people the mentality and idea to help and yanko himself be yari because of what be different ya be take care of yourself. Yanko be a no, I'm trying to say this so that people will wake up. People need to tell who a hospital the things that you see, not because if there was something more that you should have done. I am found could do that level. So I say, stress. Stress it me cool nipa. And I say, try when you stress me, bro, sugar costro. Yep. The costro. Try to, let go some stress. Now we are baby, share, meditate, read, do something that you like to de-stress yourself. We are be our new cigarette. Jai, George, go out, no George, so the cote. No, I yummy. We could see any maconom. You do harm to your body. You're ready, I'll be in case at me back, but try. So bet me I show who's to ya Ember. Obi wa insane. And say so enya bia wine kakra bia wo person wo dey relax wo ho na bi a pure na turbo. We should take care. You should have life. Now
me chawado ba wo dey assembly famu do ya say be kan wasem impotence na wo kan say binim ni so mo no madura e mema ni titiw omo bema ebe kofom do one da bia asante do no kokoje kra omo no yeah bet my highlight say bibisa na so muti control doctor na be a prescribe baby as did not for another bibi e ma o patcho bet my emphasize wo ho because obi attest me say who kan na no na no so kan obi nti na mema no enu no mo jere because some see no bebre do ono no kan e proper beta blocker asem but abam it can bet me be aka ho a what generalize na say ni enti ankofo nye compliance with their medication is almost say, man say, yeah, Momu Bema so perform. Ye beka ho asema nkasa but obet ma highlight me because obi ni nia obet me aka tro mo doctor na ya prescribe ye drama o.
Oh yes, Nyankopon chadie. There's so many medication for it. When your friend will say ufadra, now your friend decrease libido. Decrease libido just say you can't function the way you per se will function. And Robbie Brewer, Viagra. See, I'm so one person who fat pills grab and boa. You recall urologist what? There's some implant people or you grab him so what you know. Oh, bibi wo ho mbet you call urologist on be ya wo you grab him say why yeah wo to wa na wo onim, you know. And just talk to your doctor, talk to your urologist. Enro I say enro no grad wo beto so no. So if you say a cause problem amawa, you talk to your men for real, or doctor or pharmacist. You have to have a personal connection with them. Talk to your doctor. Say, hey doc, I don't know about me. I know ye. Obeti me as a son from that class and give you another class.
Right.
So I say instead say over because men no more cry because why no more cry because fat. He said diabetes. Ube one of you try one night. You know, mama show you who's yeah. Nah, yeah. And I'm more about so you drink more fluid. Fluid don't hydrate you want a clean kidney, a flushy sugar, maybe a few body more so. And that rest. So you should just try very much say about share your year now. Yeah, kasi no draw. I say, big yipa because now about hospital now reading the charter. Non-compliant, on fan we have 2-3 months on fan not stroke, you know, hammy. And to me, please, Fawundro, you know, be compliant. Na yet the doctor Becatro, who will be now Tiasia. Talk to your healthcare prof. Oh, nurses gonna for this. I mean, Chadia. The nurses for my brain. I tell you to say, who a healthcare professional be. Now be our nurse be now me pharmacist. You now because say, now you can tell the state they can take away my license. So feel free. Who go farm me because one day na me hear Juma or retail and then mommy jar retail mommy call hospital. Obia baho. Me treat me cancel no one names me a Ghana ni na ma ba half fro me cancel no and I be kun friend me ko far for no original line my cancel na roba another time I be na drew oh me kasa o phone so no sister how you Ghana ni won say once you brain why it's my life my license me ko country me kun say hey Janet be a draw way no so feel free talk to your doctor, talk to your pharmacist. Let them help you with your medication regimen. Say, dog, I didn't yet, you know, I'm a different class. Me for my child, and you have take it very seriously. She said, Sister Lydia, why are you complying from the beginning?
Right.
Yeah.
You know, it could have cost her life.
Yeah.
Program me. I'm talking from deep, you know, compassion. Say, Miss Ramon. Let us be compliant and let us take care of our life.
Yeah, that's it. Yes. Now, all council so now Frankel Foundation. What's me account and some kakra meaning say. Yes, here now you promote too.
Okay, thank you.
Now you me boy your community.
Mate, thank you.
Ebi ebe here, ye na betimi dia ye. I support enya wo edia enya ye nyina edia na ye famwa ye pacho ma wan ko
me pacho o say na Dr. Rose eka say diabetes wunya affect so on nerves so and diabetes so crofo enima diabetes the best friend hypertension enti no diabetes na also won't take you wedro no also won't take you wedro. When you hypertension, won't take you wedro. And a man also so a nurse.
Right.
And no one take you wedro. As I can't take care and answer one take care and then so would they it's one take care a bema with diabetes my worse a bet or nerves a bet attack on nerves now I did a bill and adding tina one word drew nah I said bill cry a bet take about 1,000 years and then make me say I've been me sound hypertension me sound cholesterol issues and all that now like I said, me take medru. Me taking. I've been on this medication for so many years. My sexual drive is gone, but I don't care. I don't care. My sexual drive, a true Timbuktu. I said I'm so mean. You mean who medru? And you know, my find from Timbuktu. But for all these years I've been on these medications. You know, my sexual drive is gone. It's gone. But I don't care. I don't care. Tell me, can what I say? You know, Dr. Janet Akano, we need to take everything serious because medication, when it comes to medication, and I'm starting medium and come here compliant. I come in use pump and come in use that pump, you know, because when you have these two devices on you can't even wear tight clothes. And it's in a hygiene. Anyway, so from Cal, as I said, you know, it was formed in 2018, and your main purpose, and say, your best serve to and represent and support more diabetes and more families. The piano and I can say more diabetes or more real. But when it comes to caregiving now, families, you know, breath, be so. I remember say one time I was hypo. I went hypo, and I'm when my sugar is dropping. The moment it gets to the hundreds now, it goes down fast. And you know, me echo now my machine was beeping. Me share TV. Imagine if me see me no. The next thing I knew, no, my sugar was like 42. I couldn't do anything. So my doctor has to give me glucagon shots and so. And you know, me a diabetic, you know, me ban on literally or a caregiver. And usually and we ignore them, but purpose and say yeah help and support to and represent more diabetes, you know. Now yeah supporting the families, you know, who are the caregivers, you know. And Frankel, you know, we've done so many health education, and anytime we do health education, we do free health screening. Our Ghana especially, because Ghana no Oklahoma, ye nipa 1,000. Just back up and maybe only diabetes. Some of our diabetes. It's you know, like Ghana no, you try say a bekuko a check kakra. Say I'm quite check cry, then making sure say if you media car, a back quite be a FM station, say TV station, a quite check, not on my back. And I say yeah, I send all the medical supplies from here. We ship everything. Now me the call. And you know, we've done so many. We've done like if you go to the website, all most of the work that we've done, so yeah, we're on. And I say if people donate stuff, also yes, Japonia could donate it. And yeah, to me, the people say the last time we did a donation was 2019, and I was in Ghana. You call Eastern region. So
Yeah.
I mean, minimum and when I'm doing those things now, I involve MPs, you know, so that so ebenya good reputation. And you call Eastern region, you call Eastern anything we donate. We donate books. We donate books, you donate. Say you use clothes and shoes you donate. You adult diapers you donate because living with diabetes, you know, you'll be surprised that you need to be hygiene, like your hygiene needs to be on point. So many can what I say.
Right.
Until when we get all these things that we donate, we've done a lot of donations and we do a lot of education programs. Like apart from us organizing education programs and also your core media houses, you know, to do education. And trust me, me sharing my story all over the place and people coming to our programs, you know, I'm not a performance so in your India, our yaren home. say abe for yare and yabon some yare, something I'll bet me inherit it, and I say something a lifestyle be and a bema or away. So, Obia, believe it or not, she put
donations.
drinks, cry, your program, and she put drinks from here. The pop, the amount and for participants near the other. And so if somebody wants to donate that, you go to the website, frankeldiabeticfoundation.org. Frankel Foundation, diabeticfoundation.org. When you go there, whatever you will need to know is there, and you can donate. There's a donation button there. You can donate any amount you want, and it will even give you a receipt back.
Good thing. Obi apost to frankelfoundation.org no ewo chat ni mu. Frankel Foundation ewo chat ni mu. Enti ne beka so ne se adofo e na okaye no. Omo ye adwuma papa na ye nyina dia. See a support on your boy community, especially people back home. Lack of knowledge. No na ama it do no air perishing. Yen try and support do no majority 90% of all yen web brochure your tonyama so expensive. One bag it's me talk a feed a family for 1 full year. At least yes, our bag back on what ton. Pay a support to Frankel Foundation. Near from fear, just think, the boy will be in shower so saying near my because me can't be. Ya totally 60 why in footro airborne. Say, COVID. Enti yentimi dress ya he enyama bebre ahye dem wo onyama dada ubetimi atu wo tight bra ubetimi do yesi enfan kwasori but wo dia for a good cause donate wo tight say Frankel Foundation yemfam wa adwuma papa omoye no pare so be ye adwuma papa say ya adofo no pare we need to push them we really
Mami ka bibi ba ko in church.
Sure.
Last year, me free Ghana buy and I lucky border no. Then I had one of my team members, Juma Mampontain, like Ashanti region, ho baby. Then there was this Accra. The mom and so yeah Accra. The mom is 23. Accra no 9 years old. No, they Accra ne buy it. Say Accra no like no home fan. Obia, for some reason I don't know. Check here, random sugar checker. Aprano sugar was I think say 35 millimoles per liter. Also Ghana for that's what they do. That if you multiply by 18, you benya ha say there no. Akray maame no any sika pra ode ye also mo ja akra no to ho no mo start insulin therapy. Our akra no maame no oya maame no 23, akra no 9 years old. Akra wa akra. Tell me kind of what you say.
Yes.
Let's say akra no there's mammy nisika. Oh, and I've taken upon myself. And I'm a sharp prano. Me educating mammy no every month. Me catch and say any question. Or pay or will be on for almost a crassio, a crassy until wash a cran 9-year older. Ya diagnosing a type 1 diabetes. Ne mammy, single mother. Only sika. I would be share a crano. A crano cry. And your signs and symptoms be cry when you mad for. A crown of diagnosing in 2020. When him say when your medical crisis bad 4 times. I did not to hospital. But Nino me cover because I have my team following up. So I cover all the medical bills, all her medication, everything. And our crown say, no, why is so beautiful. Just say and ne maame no amani that's why he say maame no a person or 20 school so or quiet nursing because of Frankel for a dog any a ya structure maame no ni nebusua no ama no kwa do so say or ye midwife into or school now these are some of the things that we are doing nyame aduma march ye ne breast care international for a collaboration a big program Kumasi. Into me did 2 you say platform. I need gloves, I need masks, I need hand sanitizers. If you might donate to them, I'm a ship. It's no the many say me the plane apple because I'm a ship and do. I need gloves, me here medium, me here large, me small because me team no be answer to him. It's me here medium, me here large, and I'm here hand sanitizers, me here mask. Now say I ya kwana team no, you bet me protect ya when it almost participants from the banner. It's nyama obi a mask. Na I'm in Papua time at Nase, it's education, no, yeah, a free health screening.
Yami show. Mema SKF akasani ato aso.
Okay.
SKF kasani ma. Say you are on mute.
Tampa. Hello.
Hi.
We doctors now be kind, and I'm some nurses, be focus basically on the treatments and how you share in a layman's term when you see a patient and some of the questions on within my. So I know Dr. Ross talked about type 1 and type 2. Yeah, your approach, I my patients, we say the type 1, if one take care of it very well, you will die. Basically, the letter die, meaning the DIE. So the D, becomes a diet. I, is your insulin, and then the exercise will be the E. Now, about 10 years ago, I'm focusing more about your diet, because as Dr. Ross kind of the type 1, the juvenile, and more. But this time, I'm focusing more on your insulin, so for the right insulin. And then the second thing to do is to also exercise. Diets and I said a big deal, mom was to say, because what you've realized and then they say, aqualano, obekacha and say money in the way, on yet. But you can get a child to actually exercise, and exercise potentiate insulin. And since the more we exercise, the less insulin I'll be here. To be you exercise more than eating. So it helps there. Now with a type 2, so sort of we say is you'll be dead on arrival if you go on a friend is saying emergency room, which then so soon becomes a diet and it will be the D, only the oral hypoglycemic, and then the A becomes activities. A hormone normal focusing on the diet. So because I'm find it to be calorie restrictions. And so your find it says if for dietitians already 1,800 calories a day, we're breaking it down in 6 small meals. And yankase could do for and naming at the go, but we divide it in 6 small meals because the body, the way I see bringing insulin and stuff and spreading it out, it does help. Because if you really think about it, one of the complications with, so sugar back form, if it's not a healthcare system, and obia sugar cholesterol, because I think the one misconception is that diabetics is almost almost person before insulin because they're saying, oh, my stomach flu, the core bathrooms are mean, and unfunny sugar. Meanwhile, if you're sicker, your sugar goes higher. It's you need say, oh yaria, obenum a friend is saying, unro or befa or insulin. And then another thing to the person mechanic failure. Doctor can, diabetes, diabetic patients, get very dehydrated all the time because of the insulin they are offering. So it's better for you to always take sips of water all the time because the it's a Emma. And then I know the doctor mentioned about insulin not being refrigerated and any say you call home care because if you're in a hospital setting, I'm because well, if it hasn't been open, faster refrigerator because we are the same medical and we to keeping over 28 days. But to be okay, I be or no name the difference between so we be so and I won't be so and the advice almost say they should keep it in a refrigerator. So we be so won't be so just so be dated the day and I'll be so no. Not just a way to me and no carry mono. Arabia who kakra. It's a who pa. It's I guess the message be said beyond 2 doctors in there or your own tell me. Looking at the coronavirus now and living with diabetes, what can you do and mobile to me help in, just to highlight on certain things because I think that a beboa say a bit to me I can't be so on.
Okay.
So you can't diabetes since the sugar is in the blood, right? And so there's blood saturation in the blood. And we've talked about COVID so happens to be taking care of the blood as well. Say the lungs, filtration, and then it goes all the way. People get DIC and all those in the blood. There's a huge connection when we're talking about underlying diseases, right? Into underlying diseases, diabetes, A1, and what does it cause? Into cancer, you are not. I mean, the blood is the sugar. High sugar is in your blood, and it's not being taken care of. Yet we've talked about, heart attack, stroke, and so you become more susceptible. When you have COVID now, it will affect you more. You will deteriorate because your system is already compromised. Your system already, you have all these other stuff in it. Until you have this is one that the most underlying disease they talk about will be what? Diabetes, hypertension, heart attack, and all these diseases are related. They are all related because they all go into, it's all blood related. They are all brothers and sisters. So the only thing that will help all of us, any exercise papa exercise. Because a friend said we buy, COVID buy, one way you hear about, let's say hypertension, you have high risk, we have high risk. I was so making sure, say, mentie nea ɛkɔ obi bɛka kyerɛw no WhatsApp bebree ba da bia everyday ne yɛwɔ so misinformation bebree kwa. Make sure so wako hu doctor ɛduro na me no me pa atro COVID ya abai wo hwa me risk na it say betumi asesa ɛduro na na. Instead of Jeneka, have a relationship with your doctor. Now, Edwina was almost some best summer. It needs almost a sanswa. Because Edwina will farm better because it helps you with the thinning of your blood. It helps you with this. It helps you with that. Into no make sure say ye now obia a different bibia enko nipa we ne beko nipa bi. Into you have to get your own personalized care. And you're one size fits all. Into I was say because Nina it's intertwined. One you are susceptible. You're susceptible. Once you have one of these underlying disease, when you COVID now, nyamia mpata. Oh, sorry. The obinya or bikranya own show symptom. But one underlying disease in nani na kobum. Ukunya na kayukujoto.
I said your car say your relationship, good relationship with our doctors, no quarry and here. But who says say Obia Obeba Hospital Biano? The condition you're worse than even before. Obia Obeba Obiano, a condition you're worse besides COVID. Now, Ushemwa, Aquacobase, Obia's Rose or Yaria, 6 months ago, Yaria and guess our friend a doctor, and that's a hospital. Ostroso Beko, and as a COVID in tea, Ostroso Beboson, Napa for your West. It is any kind I am passing a relationship with our doctors and as our caregivers. If you call any doctor, you can call Agent Care, question Biano, on bed answer, amount. Dr. Janet.
That's so big.
Let's just a cabet me a cabia can 1 year time will call. Now you just a question be by your answer.
Said no cano. To say health insurance bia so no or more nurses hotline. Say a bia in question bia health insurance insurance card and or better said nurses hotline or something. What question bia or to me bisa. And I say even cry no, you can even walk to a pharmacy shop bia pharmacist bia or bia no. Should be able to help you. When Timmy cry now, you can call your doctor for you and then clarify what information that you may have. Another thing is what kind of last time you can say on the COVID, the same thing, healthy eating, healthy behavior, healthy everything. Last time because take your food as medicine. It's a very good thing to continue to do. So we're doing now, you take it as medicine. So with that being said, can be cry about some natural remedy be not sometimes you want to know beside me say. The kind of make I say before so best start any natural remedy and I see even cry any over the counter talk to your pharmacist. Or call your pharmacy shop or that's all over the counter be talk to your pharmacist. Before no crown make sure say do not use multiple pharmacies. Make sure say grade I mean child your connection be I do call Walgreens square CVS on betimia pull away but so betimia maintain one pharmacy say be because CVS is my pharmacy until we walk now person to over the counter be a drug it's a pharmacist me person me to a drug can you check my profile say when you wait and then never qua or catch or say I and then never call some of the things do have me beside will say I say apple cider vinegar. Yes, apple cider vinegar is good. It also help maintain your sugar, especially bedtime. It will lower your fasting blood sugar. But instead say apple cider, you are mixing now. Why don't you use like as vinegar a year will be useful for your salad dressing. Bingo. You have vinaigrette. Apple cider, you might dressing, vinegar. Use it as your salad dressing. That is eating food as medicine right there. Do salad, vinegar, dressing, you are helping. I'm a sugar coffee because you have it there. More fiber-rich food. What does it do? It slows down. So you do more fiber and you go to the bathroom more until your carbohydrate doesn't stay in your body now. It slow down the digestion of the carbohydrate that turning into sugar. So this is some of the things that you have to do. Obi says zinc. Yes, zinc also is a good thing to help lower your sugar. Until as I said, don't do it too much. Too much of everything is bad. And also talk to your doctor. Say, this is what I want to add. Is it good? Talk to your pharmacist. Is it good? But zinc is also good. Aloe vera, almost here is good. Again, no, eat it as food. Eat medicine, food as medicine. Kakra. And you say leaf, there's a gel in it, which is very good. We incorporate it into your daily, nutrition. And also wow. Cinnamon. Cinnamon glass no. Do it in moderation. Do oatmeal. Instead, say over sugar gum. Just add about a teaspoon or so of cinnamon into your oatmeal. Then you don't need sugar. Cinnamon is sweet. You have your sugar there as the cinnamon. At the same time, where you oatmeal. You have the fiber here. You have this little bit of cinnamon going in. Another thing is to say, you see something called chromium, which is very, very also good for you if you're a diabetic. It reduces your sugar. And here, chromium, you don't have to go looking for chromium and then swallow the tablet. No, you can get it in meat, you can get it in nuts, you can get it in fruit and veggies, whole grain. Magnesium also lowers your sugar, which is also good. Don't go buying magnesium tablet. You can get tuna, has magnesium in it. Green leafy vegetables has, and chocolate. If you like chocolate, hey, here, magnesium is in there. My
guilty pleasure.
Sweetened chocolate. You have to have the dark, unsweetened chocolate. It has magnesium in it. Banana, you can get it from there. Avocado, beans. So here we go again. You are eating your food as medicine. So then vitamin C. Don't go buying too much of vitamin C. Over 1,000, you can get kidney stone. Into what you do, you can get vitamin C from blueberries, tomatoes, oranges, ginger, kakra. So bottom line is, and I add a multivitamin. I believe in multivitamin. Add multivitamin once a day to your diet.
Yo, Yamreniko, Mekasime Damasi be brave. Questions, Yaminchade. Say you call layman's time no. Questions now no so ama. It's there. A radias Yamreniko, Aka 2 minutes per na yapon. Ye meka ne say me da obi bia ase. And na yate diabetes ho asem. Yate say ye nya ka twa o say bia wanya diabetic. And na say wanya symptoms be I say we are diabetic. But modia say ubetie o doctor and na say no bekasa na wafa wadru because early detection and na so hu ne ntem no is key. And no boa ema yeso long-term complication ano ase. Ye better your guest I'll buy Lydia ase or foundation Frankel I'll boa with people are more diabetes. Now wakase do omu hia donation wo niema bebre ho or the ye the eyo link no ato ase click so na fabo a adwuma for a good cause na ebeboa wo best say bi obi wasem bi anasa greetings bi obeka na ya to aso yapon sorry
Miami.
patrai
Oh, the American say, you see, after from NDB, you take your health serious. It's all on pan, oh, I did na. And I am penny phone so good baby say, Obi Benyawa, na if you know, mommy take your health very, very, very serious, especially Africa phone because here, Osha say, I will munya, way like common, our Africa. Any of low-income countries. Over America, Hakrampa, Akatafwe, and Hispanics, hey, a diet is away, you know, you take your health serious. Now, my India, which yes, all for na doctor who be you or more German, I say this, and I say diagnosis will be here. Just accept it. Now, never follow up with care. And I think, say, so you take very good care of ourselves, and take care of our health. I think you be longer kakra ebe hu ye nanam council amokra ebi ko ebetimi ehu won
yeah that's it but your question by obi bisa say so obinya covid the sense of smell how long does it take yamre to mesre say Dr. Jen and Dr. Rose mo be answer no another time na obi so ka say everyone is different some people still don't have it after 6 months and so you be answer no for next week.
Son of just a few minutes based on my experience.
Okay.
Maybe COVID nibi. I lost taste, I lost smell, and my left ear I couldn't hear. But the left ear came back quickly. My taste came back after 2 weeks. I'll be sure in those. But my smell, no, even though it's over a month, like 5 weeks, still my smell is not back that well. Sometimes me TBB kakra, sometimes mentishy. You smell something funny. We smell like the house is burning. So everybody's different. It will take time. There's no definite time to say 2 weeks, 3 weeks, 4 weeks. People can go months before they get them back.
Okay, thank you for answering the question. Medamasi bebre na me patcho mema announcement ni ahye ne so. Se ne ka COVID kosro. Ne be ne se be protect ye ho ye be wear ye mask ye be wash ye nsa often near social distancing. Eno so nti se BBC e wo community mu ana no so nkyere sense se ye boa ye se ye support. Ye papa John Annabel papa yi waje yi din ye papa na ni obi enka me se ye so obi bia papa yi ko ye di ne na wotweda eye ochna eye 30 bia ye besre say ye kwa ye behwe ye hu yie near social distancing who show appreciation and na say who pay homage ekre abusuafo a na waba na obi so nya kwan akọ went me ankwa ye bebisa some work cash up na bi ensuo ana drinks abe mama who ye cash up now dey akakoma udin ye be register me kwanka meka think ye promote no pa since ye best one ye man akọ ni ye page ani ye yi ani ye discussing the omo a ye mo ntimi nkọ no do no ntimi nkọ na we discussing the no mo kokoto drink I think say eno be boa pa na me pa cho on be no Church of Pentecost Emmanuel Assembly 617 Lincoln Street Worcester, Massachusetts. It is any no wear your mask, social distancing, na your famwa your community. If you also want to call your papa back bio, on so some in 1 week observation, or 1 week observation, find the foster nyako ɔno nso so deɛ no ɛyɛ ɔkyena ɔmo yɛ no Providence Street 41 Providence Street ɛwɔ Worcester ha sei wontumi nkɔ wo ahwɛ na wo ho nyɛ a bɔ mmɔden afrɛ busuani ne sɛ kasha wopɛ nso so a yɛn yɛ ɛwɔ platform yi so obi a bɛma no biara no ɔde bɛkɔ yɛmfa sika ne ni da ne yɛmmoa yɛ ho meda mo ase bebree adɔfoɔ Sister Lydia yɛda ase sɛ wobaeɛ Principal yɛda wo ase sɛ agya wodi gye ma yɛ bibiara abere biara Doctors meda mo ase STF nso so yɛda wo ase for the opportunity yɛda mo ase bebree akra mo adɔfoɔ yɛda mo ase sɛ motie yɛn same time next week Friday munya aso na yɛde hypertension anaasɛ heart diseases yɛbɛba ne ɛkwan yɛbɛfa so aso ano ntɛm yɛda mo ase akra mo